I'm Dr. George Pope, and I want to welcome you to my practice. I practice plastic surgery, and I've been in town since 1988. I'm on staff at Orlando Regional Healthcare, and I perform cosmetic surgery and reconstructive surgery. One thing I like about plastic surgery patients is that they're happy, and it's a very happy specialty to be involved in. The patients are very excited about their results. They come in pretty happy, and they tell their friends about how they look. They send their friends in, and it's just a great way to practice medicine. When I was really young, even in grade school, we had a neighbor who was a surgeon, and I really thought that was interesting. He would come home and talk about things in the neighborhood that he'd done in surgery, and I was pretty fascinated, really. My family was not really in medicine, but I liked hearing about what he did in surgery, and I never really gave that up. Never gave up the thought of going into medicine all the way through high school and college. Throughout that time, I stayed interested in it and went into pre-med and went ahead into medical school and enjoyed all of the experiences there. I got further into medical school, and as I did, I started to see that there were different types of surgery I liked better than others, and I realized that I liked the idea of making someone look better, and as a result, went into plastic surgery, and I've been practicing in the Orlando area since 1988. I have a great staff here, and I really enjoy what I do. I think the whole idea of plastic surgery for teenagers is pretty controversial. There's a young lady who is actually interested in pre-med who came through my practice as a student. She spent some time with me here in the office in an internship with her high school, and she later came to me and told me she was interested in breast augmentation because she was very self-conscious about the fact that she didn't develop normally. She did go ahead to have the surgery, and it was a pretty difficult case. Due to the limited breast development that she had, she ended up having a great result, and she was very happy with the result. I think it's great in a case like this to help someone who has a developmental anomaly or problem. She's now off to college and is doing very well. I do a lot of rhinoplasty surgery. I was fortunate in my training to work under a gentleman named Dr. Jack Anderson, who's a world-renowned rhinoplasty surgeon in New Orleans. I was involved with the ear, nose, and throat department at Tulane Medical Center at the time. As a result of that experience with him, I've developed quite a practice in rhinoplasty or nasal surgery. I've had many patients over the years that have really had problems with their nose, not only because of breathing difficulty, but also because of physical deformities that they wanted corrected. Now, these deformities can either be congenital or deformities they're born with, or can be problems related to trauma. But it's great to be able to help people like this, and I've had a great number of success stories with people whose faces have really been in bad shape. I was able to help them with reconstruction, sometimes taking tissue from other parts of the body to help with the overall result. And it's pretty rewarding to be able to help people like that. I think it's important for anyone considering plastic surgery to do his or her homework. Fortunately, in this community in Orlando, we have a lot of well-qualified plastic surgeons. I think it's important to find someone that's certified by the American Board of Plastic Surgery. And you can look for that type of surgeon on our website, the American Board of Plastic Surgery website, and that's at plasticsurgery.org. Once you find someone who's board certified, it's good to get comfortable with him or with her. You need to make sure that you and he or she are on the same level with regard to what you're hoping to achieve. I try to educate patients as well as I can to make sure that they're making an informed decision about their surgery. From the minute you come into the office and set up an appointment with me, my staff works very hard to get as much information to you as possible so that you can make an informed decision. A lot of people are really interested in having something done, but they just don't know how to go about it. I think the best thing you can do is to come in for a consultation. My staff will do everything possible to provide you with the information that you need. We have brochures and DVDs in the office that give you a lot of information about the surgical procedures that you'd like to have done. Consultations are private, and we actually have a private waiting room for people who are a little uneasy and don't really want to sit in a waiting room full of other people. I try to keep this as private as possible, and certainly your medical records are kept confidential. We do give you every opportunity to ask all the questions that you need to. I actually think it's important to come in a second time before patients have surgery, so I set up a pre-op visit with each patient before surgery. At that time, we'll get to know you a little bit better. You get to know us a little bit better. In plastic surgery, everything that I do is performed in an accredited operating facility. Everything is licensed, everything is sterile. We have an entire team at your disposal. We have anesthesia services provided by a board-certified anesthesiologist. We have registered nurses who circulate in the operating room and registered nurses who work in the recovery area. I have a scrub tech who's been with me for about 15 years, and she's my right hand, if you will, during surgery. So the entire team is at your disposal. And we have a very sterile, very medical environment that you're in. You're very, very safe. If you think you're ready, and you've pretty much done your homework, and you know that you're ready to have cosmetic surgery, one thing that we do, because some people are still a little bit anxious about the unknown, is to offer to have a patient who's had the procedure talk to you. Now, I never give out patients' names or addresses, but if you're okay with this, we can give them your name and address or your name and phone number and have them call you. We put the patients in contact with you so they can discuss the experience that they've had with our practice and help you make the right decision. That's really been helpful to a lot of patients who are just about ready to move forward, but just a little bit hesitant. And often that's all they need is a little bit of reassurance from a patient who's had that same procedure before. One thing we try to do here at Orlando Plastic Surgery Center is to provide a comfortable, welcoming environment. And I have a great staff here. Everyone's very happy working here, and we do everything we can to make our patients feel comfortable.